are around 6 to 7 children with congenital heart disease which are born out of 1,000 live births which take place. So if we look at the burden, approximately around 150,000 children of varying degree of congenital heart defects are born in this country. And out of this, if we don't treat, the 50% of the children will not survive 1 year of age. So we are looking at 90,000 children which will not survive if not treated properly. And if we look at the centers currently doing treatment in our country, so we are looking at only 20,000 children which are getting operated or getting treatment for congenital heart defect in this country. So we are looking at a huge burden of the children with congenital heart defects in this country. Majority of the children become symptomatic very early in the infancy. The symptoms usually are feeding difficulty, fast breathing, they are sweating while feeding. These are the symptoms. Sometimes the children become blue while crying. So if the child has any of these symptoms, it is in all probability the child can have congenital heart defects. The other symptoms that usually presents as the child grows older is by they get fatigued early, they get tired early while playing. Sometimes they complain of palpitations, like their heart is beating very fast. So these are usually the presenting symptoms in a child at a later age. Now the treatment depends upon the severity. As I said, that majority of the children, if they don't get treatment early, 50% of these children usually don't survive 1 year of age. That means 90,000 of the children born with congenital heart defect may not survive 1 year of age. Now the treatment will usually depends upon the severity. If the lesion is complex, they usually present early. Early means within immediately after the birth, they present with breathing difficulty, they become blue on crying, the oxygen pulse oximetry saturation that we measure is low. So that's how they present, and usually these children require surgery immediately after birth. Sometimes the child will have a small hole in the heart, so these children usually may not require anything, they just require medical follow-up. Most important question that is asked by the parent is, what is the long-term outcome of this disease? So the long-term outcome is usually depending upon the lesion. If it is a simple hole in the heart, the long-term outcome is very good. The prognosis is as good as a normal child. The natural history, if you look at the natural history, they do very well in their life. There is usually no restriction in any activity, no restriction in any sporting activity as well. Now if it is a very complex lesion, like if the child was blue and the surgery is done in a neonatal period, then the prognosis depends on what kind of lesion it was. Most of these lesions carry very good prognosis. Most of the surgery is usually a one-time surgery, barring a few where the lesion was so complex that we could not do a corrective surgery, in which case the palliative surgery was done. These children usually require a lifelong follow-up and may require medications over a long period of time. And the overall prognosis also depends on whether the child has a corrective surgery or a palliative surgery. If the corrective surgery has been done, then the prognosis is very good. If the palliative surgery is done, then usually the child requires lifelong follow-up and may require future interventions also. The other problem that can happen with these children is, and for which we usually follow up these children, is with this complex heart disease, is the problem in the rhythms of the heart. That means the children can present in a later age with the history of, like, the child has a fast heartbeat. So this is something that we need to follow up these patients, and that is why in a patient who has been operated for a complex heart lesion usually require a lifelong follow-up, and sometimes may require another intervention in life also. But overall, if we look at the prognosis is very good. They can usually perform routine scholastic activity without any problem, but there may be some restriction regarding the sporting activities.